Good afternoon, Janice. Today we will have our first intake interview. I will ask you questions about your contact information, some informed consent you will sign papers, and how you feel today. Thank you for coming. How do you feel?
I feel okay.
Let's start. What is your name?
Janice Urey, U-R-E-Y.
And date, today is 26th of May 2024. Legal name, if different?
It's the same.
Where do you live, your address?
I live in Rockland on 28 Lincoln Street.
Zip code?
04841.
Gender, female. Date of birth?
12/15/1983.
Okay, some information about insurance. Do you have
I have my
insurance?
husband's insurance. I think it's Anthem. And I'll have to get my wallet.
ID number?
I think it's DM 4567.
Additional house insurance? Do you have?
No.
No. Okay. Contact telephone numbers. Home number?
207-594-6793.
And work?
No work number.
Cell?
It's the same number.
Marital status? Are you married?
I am married.
Your spouse's name?
His name is Michael, same last name. Urey.
Are you employed?
I'm not.
Emergency contact information.
My
Who you
husband.
Want to, what is his name?
Michael Urey, U-E-R-E-Y. 28 Lincoln Street, same address, and phone number 207-594-4456.
Relationship
My
to
husband.
your husband. Okay. And some information about primary care physician. How is
My doctor is at Pembe Family Medicine. And I just see different. I see whoever's available.
Okay.
When I make an appointment.
Do you remember their phone number?
I think it's 207-236-4440.
By whom were you referred?
My physician at Pembe Family Medicine.
Okay. Next one. You have to sign informed consent that you understand the risks and benefits related to treatment and evaluation at Western Psychological and Counseling Services.
Okay.
As when I gave you these papers, so we talked about this, so you have to sign that you understand everything. Any questions I have regarding this have been answered. So here, next one about your rights and responsibilities. The same, that you sign that you reviewed and understand your rights and responsibility for receiving services at Western. This includes complaints, fees, no-show cancellation policies, and your rights. I will give you a copy of these rights and. Okay, are you okay? Let's continue.
Yeah, thanks.
Next, notice of privacy practices. You have to sign that you reviewed Western's privacy practices. This includes privacy and exceptions to confidentiality. Any questions you regarding these practices have been answered, and you have a copy of these policies. You understand that Western will share basic information with primary care provider unless you ask to restrict this disclosure. Financial issues, you have to know that if you cancel within 24 hours and do not show for an appointment, you will pay a fee, $55. If you like more information about how to make a medical advance directive, you may say yes.
Okay.
If no, no. If you would like more information about how to make a mental health advance directive, the same. You have to put here yes or no. Here you have to print your name and date of birth and signature and date.
Okay, thank you.
Here. Yeah.
More information about how to make a medical. I think I would like, because I'm not sure what that means. I'm going to say yes to both of those. Okay. Okay. There you go.
Okay, thank you. Next form is adult intake form. Your name is Janice Uri and date May 26, 2024. Describe the problem that brought you here today.
Well, I've been feeling depressed and it's affecting my family, and so my husband has said I need to get help. So
okay. Please check all the behaviors and symptoms that you consider problematic. I will read and you say yes if you have this.
Sure.
Distractibility, hyperactivity, impulsivity, boredom, poor memory, seasonal mood changes, sadness, depression.
Yeah, sadness, sure.
Loss of pleasure, hopelessness, thoughts of death, self-harm behaviors,
maybe
crying spells, loneliness, low self-worth, guilt, shame, fatigue, change in appetite,
maybe
somewhat lack of motivation, withdrawal from people,
maybe
anxiety, worry, panic attack,
I don't know.
okay, fear away from home,
no.
Social discomfort, obsessive thoughts,
I don't know.
compulsive behavior,
I'm not sure.
aggression,
Frequent
arguments, irritability, homicidal thoughts,
No.
flashbacks, hearing voices,
No.
visual hallucinations,
No.
Suspicion, racing thoughts, excessive energy, wide mood swings, sometimes sleep problems, nightmares,
Not, maybe.
eating problems,
No.
gambling problems,
No.
computer addiction, problems with pornography,
No.
parenting problems, sexual problems,
Yes, I think so.
relationships problem, work, school problems, alcohol, drug, recurrent disturbing memories.
No.
Are your problems affecting any of the following? Handling everyday tasks, work, school, Recreational activities,
Maybe, yeah.
self-esteem,
Yeah.
housing,
No,
sexual
I
activity,
think so.
relationships, legal matters,
I don't think so.
health,
Yeah.
hygiene,
Yes.
finances.
I don't think so.
Have you ever had thoughts, made statements, or attempted to hurt yourself?
I don't think so, but my husband says that my drinking is self-destructive.
Have you ever had thoughts, made statements, or attempted to hurt someone else?
No, but I was laughing earlier about the homicidal thoughts because sometimes I love my family, but sometimes they make me crazy. And this is the problem. I say mean things to my family. I would never hurt them, but I think yeah.
Have you recently been physically hurt or threatened by someone else?
No.
Have you gambled in the past
No.
6 months? Family and developmental history. Mother.
My mother's name is Nuncia.
Yes.
My mother and father still live in Italy.
How old is your mother?
My mother is 68.
Okay.
My father's 72.
What is the name of your father?
Domenico,
How old is he?
72.
Okay. Do you have any siblings?
I do. I have a sister, Maria, and a brother, Domenico.
How old?
My sister's 39, and my brother is 35.
Okay. Quality of relationship?
I think it's good.
Okay. Your name of your partner? Spouse? Mike. How old is he?
He's 45.
And quality of relationship?
Yeah, not good. Not good right now.
Okay. And your children names?
Susie and Nick.
How old are they?
Susie's 8 and Nick is 6.
Okay. And family mental health problems, do you have? Yes.
My brother, he suffers from depression.
Okay.
And my father is a drinker.
Alcohol abuse. Okay. Your parents legally married, living together? Okay. Please check if you have experienced any of the following types of trauma or loss: emotional abuse, sexual abuse, physical abuse, parent substance abuse,
Yes.
teen pregnancy, neglect, violence in the home, crime victim, parent illness, placed a child for adoption, lived in a foster home, multiple family moves, homelessness, loss of a loved one, financial problems.
Well, I guess loss of loved one and childhood financial problems. I'm not anymore, but I grew up.
Did you have any mental health treatment before?
No, never.
No. Okay. Medication, psychiatric hospital, outpatient treatment? No.
Nothing.
Okay. Substance use history: tobacco, caffeine, alcohol.
Yes, all 3.
All others.
I don't do any
cocaine,
other, no
Okay.
other drugs. I'm not on any prescription medication.
Okay, painkillers, steroids. No. Okay. Have you had problems with work, relationships, health, the law?
Just for my husband
Husband. Okay.
right now.
Some medical information. Have you experienced any of the following medical conditions during your lifetime: allergies, chronic pains, dizziness, high fevers, sexually transmitted disease, asthma, surgery, diabetes, abortion?
Maybe allergies. I get
Headaches,
headaches.
serious accidents, seizures, hearing problems, sleep disorder,
Sleep. I always have problems sleeping.
stomach aches, head injury, vision problems, miscarriage,
I did have a miscarriage.
Okay. Current prescription medications,
I'm not on any prescription medication.
allergies.
No allergies to medication.
Please describe your social support network, family, neighbors, friends, students, co-workers.
Just my family.
Your family, okay. To which cultural or ethnic group do you belong?
Well, I'm Italian, but I wouldn't say I'm part of a group.
Are you experiencing any difficulties due to cultural or ethnic issues?
I need to improve my English. Yeah.
Okay. How important are spiritual matters to you?
They're important. Yeah.
Please describe your strengths, skills, and talents.
Well, before I came to the United States, I was a chemical engineer and a lab technician. And I really enjoy education, and but I'm not using any of those skills now.
Okay. Describe any special areas of interest or hobbies.
I love to be outside, so hiking and kayaking and spending time with my family.
Okay, and a few more questions. Do you work?
Not now.
Not. Okay, education. Do you have education?
Yeah, I have my bachelor's degree in chemical engineering.
Okay. Are you currently attending school?
No.
No. You said you have your degree. It's in your country. Okay, what kind of degree?
I think we would call
associates.
it the bachelor's.
It's
Undergraduate.
undergraduate. Okay. Year of
I
graduation.
graduated in 2002.
And the major of your studies.
Chemical engineering.
Okay. Military service.
No.
Legal. Have you been convicted? No.
No.
And a few more questions about most commonly reported thoughts, feelings, and behaviors among adults seeking behavioral health treatment. So please think about the past 2 weeks and answer the questions below to the best of your ability. So then we will better plan your treatment and monitor your improvement. So how often did you feel unhappy or sad? You have to answer from never to very often. Never, hardly ever, sometimes, often, very often. So feel unhappy or sad.
Often.
Often. Have little or no energy.
Often.
Often. Okay. Have a hard time getting along with family, friends, or co-workers.
Often.
Often. Feel hopeless about the future.
Often.
Have a hard time paying attention.
Sometimes.
Feel unproductive at work or other daily activities.
Often.
Feel tense or nervous.
Sometimes.
Have problems with sleep.
Very often.
Feel lonely.
Very often.
Think about harming yourself.
Sometimes.
Have someone express concerns about your alcohol and drug use.
Sometimes.
Have more than 5 drinks of alcohol at one time.
Sometimes.
Sometimes. Have a problem at work, school, or home because of alcohol or drug use.
Often.
Often. Please take a moment to assess your last session to help us better serve your needs. Please answer according to their relevance. I felt that we talked about the things that were important to me. True, almost true, unsure, almost false, false.
True.
I felt that the therapist liked and understood me.
True.
I felt that the session was helpful.
True.
I felt confident that the therapist and I worked well together.
True.
That's it.
Okay.
Thank you very much for coming.
Thank you.
See you next appointment.
Okay. Sounds good.